Welcome to McDougall. On today's show, Dr. John Lee will challenge the millions of women who are on estrogen therapy. Hello, I'm Wayne Judd. And now, the author of several best-selling books you may not find in your doctor's waiting room, Dr. John.
Thank you, Wayne.
Nice to see you.
How do you feel when you find out people are misled?
It angers me.
It angers me too. And you know, one of the things that's going on in this country right now that really disturbs me is the fact that people are trying to get healthier, but they have misinformation. Like, for example, they think low-fat and no-fat dairy products are health food. Does that surprise you?
Well, that's what I do.
You think they're okay,
it's
right?
It's not true. I think they're fine. That's what I've been told to think.
All right, you gave up the high-fat dairy products
That's
for
right.
a good reason, because the fat makes you fat.
That's right.
The fat causes heart disease.
Right.
Promotes breast, colon, and prostate cancer.
In fact, we've gone all the way from 4% to 2%, and now we're at 1%. And we're thinking of going all the way to skim milk, John.
Well, every time you lower the fat in your dairy products, you increase the relative amounts of protein and carbohydrate. Now, I bet you never thought of protein and carbohydrate as causing problems in the dairy protein in the dairy products, right? Well, let's talk about this for a minute.
Okay.
The number one cause of food allergy, if you have a child, you take the child to an allergist or a good pediatrician with a snotty nose, with ear infections, with asthma problems, rashes, bedwetting problems, a smart allergist or pediatrician will tell you, take them off the dairy products because it's the number one cause of food allergy. Have you ever heard that
Dairy
before?
products are the number one
cause of food allergy. You've probably heard about it in terms of it causing mucus, maybe, dairy products causing mucus. It's the protein that does that. Now, those are minor allergies that people get, but there are more severe reactions that people get. And I know it's going to shock you, but childhood diabetes, type 1 diabetes, is caused by dairy product consumption, the protein part, in young children. And also, in some people, rheumatoid arthritis is caused by the dairy protein. Now, those are very serious diseases. But one of the more shocking things, if I haven't gotten your attention so far, one of the more shocking things about dairy products, you read in the newspaper all the time. I mean, does it disturb you, Wayne, when you look in the newspaper and you find out that cheese is infected with E. coli bacteria?
Oh, very much so. Very much so.
But not enough to give it up, right?
I've thought about it.
Or you hear that the dairy products are infected with tuberculosis bacteria, or salmonella is another common infectious agent. You see, these are animal products.
But it seems so rare, John. It just doesn't seem like I'm apt to be impacted by
Then let
that.
me give you one that you're going to think about for a while. We'll discuss this on another show in some detail. Do you know that 60% of the dairy herds in this country are infected with bovine AIDS virus and or bovine leukemia virus? 60%. Is that rare?
You have my attention.
Yeah, I have your attention. Well, I want to get your attention because I want you to start thinking about dairy products as a serious health hazard. Even when you take the fat out of the dairy products, it doesn't solve all the problems. You've got allergic reactions, you've got infection problems. You also have the problems of the dairy sugar, which is called lactose, and many people are lactose intolerant, and they get stomach problems when it comes to that. So, I'm going to share some real powerful information with you, Wayne.
Sounds terrible.
And you'll have to find out something else to put on your cereal, like?
Don't say it.
Well, what I would suggest is soy milk, various kinds of nut milks, or even fruit juice, as strange as that sounds.
Okay.
Well,
fruit juice? Okay.
You listen up. We're gonna talk about dairy products and calcium.
Well, we'll have to talk
We've
about that
got a great
more.
guest coming up, Wayne.
Good.
We've got Dr. John Lee, and he's going to tell you some things about osteoporosis and dairy products and ways of treating osteoporosis that I think you'll find extremely valuable.
Very good.
We'll be back in just a moment.
I Learn English, you can also on Hello Channel.
And welcome back. With me, Dr. John Lee, medical doctor, family practitioner when you started out, right? And he's the author of a book called Natural Progesterone, and we're going to give you some information at the end of the show on how to get this book. How'd you become interested in osteoporosis and how to treat it, John?
Well, in family practice, you start in and you have patients, families with age 20, 30, 40. 30 years later, these same people are 60, 70, and 80, and osteoporosis is there.
Is that a big problem? Osteoporosis is a common problem. I know it's a household word, but I mean, do people really get into trouble with broken hips? And
absolutely. This became a major practice. As I aged along with my practice, I could see that osteoporosis was not only just the fractured hips, but it was the deformities that were occurring, the inability for people to get around as well, of course the likelihood of fracture, and it was also the fear. They could tell that they were shorter, they could tell that their bones were decaying, they were losing bone mass. And I became interested because, for one thing, I was quite aware that estrogen and vitamin D and calcium and the typical dietary changes and quitting cigarettes wasn't curing osteoporosis.
Well, that's what we're told. I mean, every woman in our listening audience believes the solution to the problem is to get more calcium.
I know.
You don't believe that?
No.
Can we get a good working definition of osteoporosis?
Osteoporosis, well, it's the loss of bone mass that happens, accelerates about the time of menopause, and as people age, they lose more and more of the bone mass. And by that I mean the mineral content and the structure of the bone gradually decreases. The bone becomes more porous and more likely to break.
So we prevent it with calcium. I mean, it's obvious. I mean, I'm told every day, every time I turn on the television set, I just take more calcium. That's the solution.
I know, and I was quite concerned that that was not the solution, because we had in Marin County at that time a bone mineral density testing lab open up, and we could follow the bone mineral density year by year, and we could see that the bone was becoming more porous and less dense, and they were losing calcium regardless of
even if you take the right breath mints, you to get the right calcium.
Right. So
the right antacid.
right.
Or the antacid.
Yeah.
All right.
You know, one of the things that's always disturbed me, and I think should disturb every scientist, is when you look around the world and you see that when people eat more calcium, they get more osteoporosis.
Right. Well, as far as that goes, if you look around the world, the societies that do not have our particular diet, they don't have our meat, they don't have our milk, they're more agrarian society, they don't have the osteoporosis.
Like, give me some specific examples where I could go in the world and I wouldn't find hip fractures in women in their 60s, 70s, and 80s.
Well, it's mostly the areas that I would regard as the tropical areas across Central America, across Africa, across India, southern China, and
they drink no milk there.
And they drink no milk.
Not after they wean from mother's breast.
What, you know, America's an interesting country. The dairy industry has the gall to say, we are the country that drinks probably more milk per capita than any other country. We're the country that has the worst bones in our skeleton, and therefore we should drink more milk.
Yeah, well, why do you think
why
they
do you
say that?
follow that logic? Follow that logic.
Good marketing technique, at least, huh?
Yeah, somebody should stop and step back and look at the whole
and then,
problem.
And then I was treating these women with estrogen. And in 1976, as I recall, Mayo Clinic had a consensus conference, and they said no one should be on unopposed estrogen because it's the only known cause of cancer of the uterus, endometrial cancer. And also I was seeing other side effects from estrogen. The women were retaining water, they were getting fat around their hips and their abdomen, they were getting depressed, they were losing their libido, and it wasn't really helping their bones that much.
Well,
so there's something.
But John, any woman, you know this as a doctor just as I do, any woman who walks into a doctor's office
complaining
in her late
anything,
40s, well, she doesn't even have to complain, she just has to be near 50 years old, and she is told you have to be on estrogen. If she goes home without it, she's often called at night to be told that she has to start this estrogen. The doctor tells her that.
Right, and then when the worry about cancer of the endometrium came up, you had all the drug companies coming forward and say, well, we have some nice progesterone to give you to take with the estrogen, and our progesterone will prevent the endometrial cancer.
And it does.
And the progesterone they were giving was the synthetic progestins that were developed for the birth control
and
pill.
Does it prevent uterine cancer?
Yes, it does.
Well, see, everything's solved then. We solved the whole problem. We just take estrogen and progesterone.
Except when I'd look in the PDR to see the side effects, and there'd be a page and a half, 6 columns of side effects from these synthetic hormones. It was a real dilemma. If we treat them with all of the hormones as directed for their bones didn't get very well, and we were putting them at increased risk of breast cancer and cancer of the uterus and all the other side effects. So towards the end of the 70s, I regarded this as a dilemma that I didn't know how to solve. I was frustrated.
Here you are, you're a doctor, you want to help your patients,
right.
And you're giving pills that are making them sicker.
That's right. That's exactly.
Isn't that a common scenario? I mean, that's the business.
Right. And then I heard this talk by Dr. Pete, a PhD chemist from biochemist of Oregon, and he told me about natural progesterone.
And natural progesterone is where it really turns your life around, isn't it? I mean, you've done
turned
so
my
much
practice
research
around.
on that.
Yes, that was 1979, and began, well, first I reviewed all the literature that Dr. Pete had discovered. I found more in the European literature, and I found that there was no side effect. I found that it's obtainable from soy and from yams. It's a perfectly natural thing to take.
Well, Dr. John Lee, our listening audience wants to know a lot of things from you. They want to know what does really cause osteoporosis. They want to know how they can get off the estrogens their doctor's putting them on, or even avoid taking the estrogens. And they want to know if there's a real alternative, like you suggest, progesterone cream, how they get it, whether it's really safe, what the side effects are. I mean, we've really got their curiosity up, I want to tell you. And we're going to answer all those questions with you, Dr. John Lee. And you folks, just stay tuned. In a moment, we'll get all your questions answered about osteoporosis and progesterone. Be back in just a moment.
Learning a new language can be difficult and discouraging, but it doesn't have to be. Hello, I'm Karen, introducing Hello Channel, the revolutionary new channel designed especially to teach English. If you can speak English, the future is open for you, since speaking English means greater opportunity and higher paying jobs. By watching Hello Channel, you are immersed in this valuable language. You'll hear the words being spoken. You'll see the speakers' mouths when they say the words. You'll read what's being spoken in large, clear subtitles. And you'll speak out loud, practicing what you have just learned. There is no better or faster way to learn a language than total immersion. Hello Channel does exactly that. There's programming on every level, so you can watch the shows that are just perfect for you. Whether you've spoken a little English, a great deal of English, or none at all, the Hello Channel has something for everyone. Join us for a convenient, affordable, and fun way to shape your future. There's so much in store for you if you'll just say hello.
And my guest is Dr. John Lee. We're talking about natural progesterone. We're talking about osteoporosis. And I know this sounds controversial to you. If you object to what we're saying, if you don't think it's right, if you're a doctor and you think we're giving misinformation, don't hesitate to write us. You'll find the appropriate address at the end of the show. Dr. John Lee, there's got to be a cause. I mean, women were not poorly designed. There's got to be a cause to osteoporosis. So
I agree.
What is it?
I agree. I studied how bones grow. Bones are living tissue. They're always being formed, reabsorbed, the tissue is resorbed, and then new bone is made. It's not like teeth. If you break a tooth and put it together, it's not going to mend. Bones can mend, bones can grow, bones can lengthen as a child grows, and so on. And it turns out that in reviewing all the basic literature, estrogen has never been shown to increase new bone formation.
Right, but what causes osteoporosis?
What causes osteoporosis is the lack of new bone formation, and new bone formation can be stimulated by progesterone, but there's a whole bunch of other factors.
All right, well, what are some of those factors that I can control?
All right, okay, excess protein
intake. You know, like
intake.
you just told me, you told me that women in Asian and African countries have very little chance, so there's got to be something different about them.
All right, excess protein.
Excess animal protein?
Especially animal protein, because the sulfur connections with their amino acids results in metabolic acidosis. That is acidic condition determined by the urination of the metabolic waste products.
Okay, so in other words, you're taking the protein, which is made of amino acids, and the acids make you acidic, and the bone has to buffer that.
We can't store protein.
Okay.
If we take more than we need, we have to excrete it in the urine, and with that, the kidney is able to draw calcium out of the bones in order to buffer the acidosis that's occurred.
Okay, so then the solution to the problem is obvious. We change our diet.
That's
Get some exercise.
That's right.
So why bother with progesterone cream?
Well,
oh, we don't have to bother with any of this stuff. You wrote a whole book about it. We can just throw this away, right?
No, because they come to me with the osteoporosis already there.
Oh.
And without the progesterone, they cannot build new bone. Turns out that progesterone is a hormone made by the follicles of the ovary, and that it's epidemic in the United States today that women lose the follicles of their ovaries 5 to 8 years prior to menopause. And they are therefore progesterone deficient. They cannot restore the bone that is being lost, and estrogen will not do it. And they arrive at menopause having lost 20–25% of their bone mass already. This is brand new in the history of women.
Progesterone cream. Progesterone is the pregnancy hormone.
That's right.
So why would a woman want to be pregnant when she's 50 or 60 or 70 years old?
Yeah, because the amount that's needed to cause new bone formation is much less than the amount that she makes during pregnancy.
And you think that it would be a natural, normal thing for a woman to carry higher levels of progesterone in later years, and she's just not, is the problem.
Dr. Elliott of Harvard has been working with the World Health Organization. He's developed a technique of measuring progesterone and estrogen levels by testing saliva. He has a radioimmune assay, and the World Health Organization has been testing hormone levels in women around the world, and they find that women in the so-called third world countries, the more agrarian societies, when they go through menopause, they still have plenty of progesterone. They get it from their diet. It still shows up in the saliva. Their estrogen level only drops a little bit, just enough so they don't have periods. They don't even have a word for hot flashes. They don't know what menopause is, except the relief of not having to have periods anymore, not have to worry about pregnancy. Whereas in the industrial world, such as Western Europe and England and the North American continent, premenopausal women have a very high estrogen, and it falls just below the level that's needed to have periods, but that fall is considerable because of the abnormal height. And the progesterone drops out of sight 5 to 8 years prior to menopause. It drops to levels lower than that of a man.
Okay, but it still comes down to the diet and unhealthy lifestyle. But you're going to help rehabilitate some of these women.
Right, but diet?
But with the progesterone cream. Let's talk about what the advantages are of the progesterone cream. I mean, first of all, how do you use it?
It can be applied just anywhere on the body, skin. And it's absorbed through the skin. There are also drops to be taken that you can hold in your mouth. There's also companies now coming out with capsules of micronized versions of
And what kind of benefits should a woman expect who's going to take progesterone in any of those forms?
Well, let me tell you this first, that the absence of progesterone results in estrogen dominance because they have too much estrogen. We're talking 5 to 8 years prior to menopause.
But most women think that's okay.
They're going to have fibrocystic breasts, they're going to have fibroids, they're going to have endometriosis, they're going to have headaches, depression, loss of libido, weight gain, their cholesterol will not be as good as it ought to be. And all of these side effects of estrogen is turned around when you add the natural progesterone.
Okay, so you add the progesterone, you take care of the estrogen excess diseases, so a woman can expect to feel better?
Feel better, sleep better.
Look better.
Her libido will come back.
And you believe, Dr. John Lee, you believe the bones are going to be stronger?
Not, the reason I believe it is that we have done bone mineral density tests on a serial basis over a number of years on a number of patients, and we've seen the increase. On the average woman, the increase is over 15% in 3 years, and on the people with the worst osteoporosis, the increase is 25–30% in 3 years.
Well, Dr. John Lee, what we have to deal with now, like all medications, this must have terrible side effects, terrible costs. If it really worked, and everyone in our audience is thinking this, if this really works, why isn't every doctor prescribing progesterone cream to their patients if it's so simple, so natural, so safe, so effective? You've got a big job ahead of you to convince our listening audience that this stuff is as good as you say it is, but I'm going to give you a chance.
Okay.
And I really think you're up to the job. We'll be back in just a few moments. Dr. John Lee, he's the author of Natural Progesterone, and we'll be back with you folks in just a minute.
Hello. That's right, I said hello. I'm talking about an exciting new television channel that will change your life. My name is Ruth, and I want you to be one of the first to know about Hello Channel. Hello Channel is designed to teach you to speak English. Anyone can learn. We offer something for everyone. You'll see programming for children, teenagers, and adults, all on different levels. With Hello Channel, you'll hear, see, read, and speak English as you're watching entertaining television programs, making it easy to learn. If you've always wanted to learn English but haven't had a chance, Hello Channel is perfect for you. Start today, and remember, for a brighter future, just say hello.
Once you figure out how to speak your kids' language, well, you don't really have to say much at all. from the Church of Jesus Christ of Latter-day Saints.
And with me, Dr. John Lee, we were talking about osteoporosis and also natural progesterone. We'll tell you how to get Dr. John Lee's book at the end of the show. Drugs, all kinds of drugs, Dr. Lee, all kinds of drugs have side effects. Now, if this is going to have positive effects, you've got to tell me what the adverse effects are. I've read about them. Raises your cholesterol, raises triglycerides, mood changes.
Right. All those things that you've read, even though they use the word progesterone, they're not talking about progesterone. Turns out that progesterone, the natural form that the ovary makes, can be extracted and made from plants. And the drug companies do that. They actually grow the soy and they grow the yams and they obtain the natural progesterone, and then they use that so they can modify it and create synthetic versions. They create a molecule that is not the same as the natural one because they can patent the synthetic one.
And we're talking about money? Are we talking about money again?
Is everything economics? I think it is.
Right. They don't call them patent medicines for nothing. If a medicine is patented, and you do all the work to prove that it's safe and effective, then you control the sales, distribution, the price, and so on. If it's a non-patentable natural product,
and that's what progesterone is.
And you're going to be asked to spend $150 million to do a double-blind, placebo-controlled study of 1,000 women over the next 5 years. Once you've proved something, everyone can use it.
Okay, the most important question, what does it do to your sex drive?
Well, there are some...
You can really sell a lot of cream here now, John.
There are some recent neural hormonal studies that have found the center of the brain where the sex drive originates. And they find that either testosterone or progesterone is the one that causes it to fire off and not estrogen.
Okay, how about, we've talked about progesterone
so I tell the patient, the women patients, that the guy across the room will get a little better looking, but that's about as far as I'll go with that.
It's not excessive.
Yeah.
Can I ask a question about the gender issue? It sounds to me like this is a lot of talk about women and women's problems. Is it relevant to me as a male person?
It turns out that the bad diet and the petrochemical derivatives that are contaminating our food supply, especially when you eat animal products, because the animals eat all the grain that's been sprayed with all the insecticides. Those particular things that damage the ovary, so it is not producing progesterone like it should, is also damaging your prostate. And that you are going to have a lower sperm count. Sperm count has dropped 50% in the last 35 years in the industrialized parts of the world, and prostate cancer is rising.
So, Dr. Lee, where do I spread the cream?
No, I think he's trying to tell you, Wayne, that you need to change your diet.
Yeah. You have to avoid.
Do you ever recommend this cream for men? I mean, is there ever a circumstance?
Yes, the circumstance is it's based on this. Testosterone and progesterone do so many of the same things in the body. They both help create more energy, more strength. They're both antidepressants. They're both picked up by brain cells, and so on. And so when a man takes progesterone, his testosterone will drop in relation to the amount of progesterone he took. Now, if a man is being treated for prostate cancer and he's going to a doctor that wants to castrate him and does, then he does not have any testosterone anymore, and he is going to get osteoporosis severe within 3 or 4 or 5 years.
So would you recommend progesterone cream for that? I mean, that's a big step.
I recommend progesterone cream for men who've been castrated as a result of their prostate cancer.
All right, now, there's scientific evidence to support this, but there's not the dollar, and you think that's the problem?
That's the problem, right. For instance, a study at Johns Hopkins ran for almost 30 years. They were monitoring the estrogen progesterone levels of women that were passing through a particular clinic in that hospital, and they, after 30 years, evaluated the women and compared it to whether they had normal progesterone production or they were low. And it turns out the breast cancer rate was 5.5 times higher in the people who had low progesterone, and that the overall cancer rate was 10 times higher in the people who had low progesterone. And low progesterone is becoming the epidemic standard for women over 35, 36 years old.
This is going to have to be another one of those grassroots type things, Dr. John Lee. Women are going to have to find out about it.
Right.
They're going to have to appreciate the benefits of natural progesterone cream and tell their neighbors.
And then they have to fight with their doctor.
That's true. That may be a job that's too tough for them. But all the scientific data is in your book, Natural Progesterone. Tell us how to order it. Tell them where they can get the creams.
Right. There may be some health food stores and bookstores that are carrying it, but I don't have them in my mind.
And one of the most important
things
is
if they want
it's
to,
safe.
It's P.O. Box 2068 in Sebastopol, California, 95473. The total cost of the book, including the handling and the packaging and the postage is $12.
Thank you very much, John Lee. And folks, we look forward to joining you next week with some more challenging opinions.